Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for chapter 17, which covers congenital malformations, deformations and chromosomal abnormalities. Now coming to the various guidelines that are covered under chapter 17. The first one is assign appropriate codes from category Q00 to Q99, congenital malformations, deformations and chromosomal abnormalities whenever a malformation, deformation or chromosomal abnormality is documented. It can be either a PDX or SDX depending upon the reason for encounter. The second point is when a malformation or deformation or even chromosomal abnormality does not have a unique code, then assign additional codes for manifestations that may be present. If one unique code that identifies that abnormality is not present, then you can code any manifestation that may be present. Next point is when the code assignment specifically identifies malformation or deformation or chromosomal abnormality, and the manifestations that are inherent component of the anomaly should not be coded separately. Manifestations are nothing but it may be symptoms. Symptoms which are integral part of that abnormality, if they are related, if they are inherent component of the anomaly, they should not be coded separately. Additional code should not be assigned for manifestations that are not an inherent component. When the manifestation is an inherent component, you should not additionally assign code for manifestation. Next point, the codes from chapter 17 may be used throughout the life of the patient. If a congenital malfunction or deformity has been corrected by any surgery, a personal history code should be used to identify the history of the malformation or deformity if it has been corrected. And these conditions, they are present throughout the life. If it has been corrected, you need to use a personal history code to indicate the history of manifestation, malformation or deformity. The next point is, although present at birth, a malformation or deformity or deformation or chromosomal abnormality may not be identified until the later years of life, whenever the condition is diagnosed by the provider. If it is a congenital thing, then you need to use appropriate codes from category Q00 to Q99, irrespective of the time of detection. Finally, for birth admission, the appropriate code from category Z38, live born infants according to the place of birth and type of delivery, should be sequenced as PDX, followed by any congenital anomaly codes. This is important point. For the birth admission, the appropriate code from Z38 category should be the PDX, followed by any congenital anomaly codes which come under Q00 to Q99. Now let us see examples for those guidelines. Let us consider the first example, which covers the Z38 code category. When a congenital anomaly is identified at birth, the birth encounter should be sequenced first, which comes under Z38 category, followed by appropriate codes from category Q00 to Q99 to identify the anomaly. Let us see an example. Following vaginal delivery of a single live born infant in the hospital, Dr. Patel noted webbing between the toes of the neonate's left foot. So here the PDX would be Z38.00. Single live born infant born in hospital delivered vaginally, followed by Q70.32, webbed toes left foot. Now let us see one more example. Here Alex, 3 years old, presents for her annual healthcare maintenance. In the medical record, the past surgical history indicates ventricular septal defect repair. It indicates that patient has a congenital anomaly and it has been repaired by surgery. In this case, you need to use category from personal history to indicate that that particular congenital anomaly has been repaired. So the PDX would be patient is presenting for annual healthcare maintenance. That would be Z00.129. Encounter for routine health examination without abnormal findings. Encounter for routine child health examination without abnormal findings, followed by Z87.74, personal history of corrected congenital malformation of heart and circulatory system. Coming to second example, Shannon is seeing Dr. Williams for follow-up of her tetralogy of Fallot. Shannon has undergone one surgery to begin repair, and Dr. Williams anticipates Shannon will need 2 additional surgeries before repair is complete. Here, repair has been started, but still the congenital anomaly is not completely treated. In this case, you need to code the congenital anomaly only. So the appropriate code would be Q21.3, tetralogy of Fallot. Coming to one more example. Amanda returns to Dr. Adams' office with her parents to discuss her upcoming surgery to repair left-sided cleft lip. Cleft lip is also a congenital anomaly. So the appropriate code is Q36.9, cleft lip unilateral. Coming to second example, John presents to Dr. Smith's office complaining of fatigue. John has non-mosaicism Down syndrome. Here, this is a manifestation. Fatigue is a manifestation and it is not related to Down syndrome. So you need to code the manifestation code additionally. So the appropriate codes here, and the reason for visit is fatigue. So R53.83, other fatigue, followed by Q90.0, trisomy 21, non-mosaicism. This is nothing but Down syndrome. And any manifestation that is not an inherent part of the congenital anomaly should be coded with additional diagnosis. So other fatigue is not related to Down syndrome. So this is coded additionally. Coming to next example, Melissa is seen for difficulty swallowing associated with her cleft palate. Here the patient is also having a manifestation, that is difficulty swallowing. But this manifestation is an inherent part of the anomaly. Difficulty of swallowing is related to or occurs due to cleft palate. So you need not code additionally difficulty in swallowing code because it is an inherent component of that anomaly. Appropriate codes are Q35.9, cleft palate unspecified. Coming to next example, Mitchell was diagnosed with subglottic web of the larynx. During a follow-up evaluation for this condition, Dr. Jones noted a cardiac murmur upon examination and has ordered an EKG. Here patient is having web of larynx, that is the congenital anomaly, and additionally doctor noted cardiac murmur, and this is not related to web of larynx. So you need to code additionally. The appropriate codes would be Q31.0 to indicate web of larynx, followed by R01.1, cardiac murmur unspecified. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.